Okay. So a few things I want to go over before we begin. Essentially, pre-op and post-op nursing is quite the specialty. So if you choose to go down a career path for pre-op, post-op, even I believe it's like theater nursing where you're actually in the OR, it is a specialty. So when we're talking about what we need to know for the NCLEX, it's kind of very basic overview, and it focuses a lot on not necessarily working as the pre-op or post-op nurse, but a lot of it is sending your patient to surgery. What do you need to do on the floor with your patient before transport goes ahead and takes them down to wherever they go? Also, we're going to focus on what happens once our patient returns back to us in the unit. We'll go over a little bit of PACU considerations, but ultimately a lot of it is going to be how we're caring for our patient, if that makes sense. Because again, it is quite a specialty, and NCLEX doesn't like to go super in depth into specialties. So we're just going to do, again, a very broad overview of pre-op and post-op as well. Okay. So without further ado, we will go ahead and we will begin. So when we're talking about our preoperative care, this is what happens when my patient is scheduled for surgery and they're about to go ahead and be transported. As a nurse, we can help provide education, we can advocate for our patients, and really promote health and safety. Meaning, if your patient is scheduled for surgery and you've noticed that their vitals just really haven't been stable, it's our job as the nurse to figure out what's going on and also advocate. Maybe we need to hold our patient. Maybe we need to call the provider, call the OR. My patient's not going down. If I feel that it is not safe for my patient to travel, I'm not going to send them down. How do we determine if it's safe to go? We do our pre-operative assessment. So this helps us really process, plan, and teach our patient on all things surgery. So obviously we need to get a full set of vitals. We're going to do a quick review of the systems. But ideally, patient safety is our number one concern. So we need to be looking for any sort of hazards, like I've mentioned, unstable vitals. Or maybe my patient's blood sugar is just, they're hypoglycemic or severely hyperglycemic. I need to get that under control in order to prevent post-operative complications or even complications during surgery. So what are we going to do? We're going to first do our quick little assessment. We're going to do their past medical history, review their meds, allergies, review their systems. This is like your quick head-to-toe assessment. You want to do that before sending them. That way, when they come back to you on the floor, you have data to compare. You have a recent assessment, and that's really, really important because that's how you're going to identify if there's complications. If you notice that your patient's vitals before they left you were X, Y, and Z, and now they come back and they're all over the place, you need to identify that that is abnormal. That's not my patient's baseline, and we need to kind of work together. Couple legal considerations as nurses: we cannot obtain consent. We can witness consent, but we have to be the ones that verified that the patient gave their consent, and also informed consent. What is informed consent? This means that my provider sat down with my patient and they explained the risks, the benefits, complications. They kind of really let them know what's going on. And an interesting about informed consent is, let's say I go to my patient and I say, did the provider explain everything to you? And they tell me, well, yeah, they did, but I don't know what any of it meant. They were talking in like such intense medical terms that my patient doesn't know. At that point, I cannot, as a nurse, verify that our informed consent was given, because if my patient doesn't understand, I need to call my provider back, and my provider needs to come back and re-educate. Okay. Additionally, before our surgery, we need to make sure my patient was NPO, no eating, no drinking, no smoking, none of it. If a family member sneaked in some food, ooh, we're gonna have to postpone surgery, and trust me, no one wants to stay longer in the hospital than they have to. Okay, so verify your patient was NPO. If your patient is diabetic, usually they need snacks, they need to eat, but if a diabetic patient is NPO, you cannot give them food. Therefore, you're going to want to give them IV D50. It's dextrose in a solution, in an IV solution, and that's how they're going to be able to keep their blood sugar okay. So if your patient is diabetic and before surgery they become hypoglycemic, you cannot give them a snack. You can't give them a snack because they still need to be NPO. That takes priority. Okay. After they've kind of left us, we want to kind of look at our transportation to the OR. So again, quality and safety is a must. How do we do that? We make sure we're ensuring proper handoffs where we're communicating the recent set of vitals, my patient's previous medical history, the SBAR, what's going on, what labs we're possibly waiting on. So it's really important to have proper handoff. You want limited interruptions. You want to provide opportunities for that OR nurse to ask questions and to clarify. You can ask for them to do a read back or a teach back. Those work really well. So in a nutshell, when we're going over our preoperative checklist, we really need to make sure that the patient teaching was completed, consent form was signed, and that we verified my patient is NPO. Additionally, we need to make sure my patient is a gown with their ID bands on and that they have no jewelry on them, no valuables on them. They either need to be left with a family member or left in a room, preferably left with a family member. Okay, we also need to make sure the pre-op meds have been given, the side rails are up, and our vital signs have been collected. You also need to look at your patient's medications and know what meds do we possibly need to hold before surgery. Those will be indicated by your provider. Also, we need to make sure all pre-lab work is done and it is in their charts. When we actually transport the patient, we bring their chart with them. You have the chart, it's got the consent form, it's got their labs, it's got everything. You just place it on the bed with them and they go. Okay. You also, if there are any abnormal lab values, you need to assess and figure out, is there an underlying cause? Is that maybe just something else going on, etc. Specifically, look at your potassium levels, your sugar levels, and your hemoglobin and hematocrit levels before surgery. Those are really important. Obviously, potassium, that's a major electrolyte that messes with the heart. Sugar, that's going to impair a lot of things. And low H&H, if my patient's hemoglobin and hematocrit is very low, I don't want to send them down for surgery where they might be cutting open my patient and they're going to bleed out. That's a really big issue that might cause their surgery to be postponed. Okay. So now we're going to talk about intraoperative care. So again, this is more of our PACU nurse. PACU nurses also can go with patients to surgery depending on the facility. When I was at Lakeland, the PACU nurses went to like interventional radiology, spinal taps, etc. Okay. So when we're talking about intraoperative, this is from the time the patient comes into the surgical suite till the time they leave the PACU. Or, well, usually if they leave the PACU, they either go home or they will go back to the ICU or whatever floor that they were on, okay? So teamwork and safety is our #1 concern. If you're going to be going into the OR, you need to make sure you do your surgical scrubbing where you are washing your hands for 3 to 5 minutes. Just kind of review how these nurses wash their hands, how the water runs down, it doesn't run up. Additionally, these patients are at an increased risk for infection. So really promoting anything to prevent infection is very, very important. The surgical team can consist of your surgeon and your assistants, anesthesiologists, scrub nurse, surgical technicians, etc. This is for amputations or surgery on legs, arms, limbs, whatever. You also really need to make sure you confirm the surgical site prior to the start of the procedure. For like amputations, usually they'll write on the leg that they are amputating just to avoid medical errors. Usually your patient's going to be under anesthesia. You have your general, balanced, and your local anesthesia. or even moderate sedation. It's not important to know the very big details of each. I would just know that when your patient's under anesthesia, just monitor airway, breathing, circulation. Also, it's very important as the scrub nurse to do an instrument count, meaning all of your instruments are accounted for after the operation. So if you went into your operation with 14 tools, before my patient leaves the operating table, you better verify that all 14 tools are there. Okay, if there's any discrepancy, you immediately have to notify. Most of our complications during surgery involve hypothermia, which can lead to an acidotic state, possible dysrhythmias, etc. In order to treat that, we really want to make sure we give oxygen, get a good set of ABGs, IV fluids, cooling blankets, etc. Then finally, post-op care of our surgical patient. So this is after my patient has completed their surgery and they are transferred to their destination. Okay. As a PACU or recovery room nurse, they help stabilize the patient, prevent complications, and treat complications. So essentially, your post-op assessment is going to look a lot at looking for emergencies, identifying those trends that my patient might be going in the negative direction. Vitals are super important, and really receiving a good handoff report. You have to identify your patient's intake and outputs. You have to look at their incision, the tube drainage, presence of any dressings, and really look at your dehiscents versus your eviscerations. So I would just kind of review that. One involves just opening and the other involves organs protruding outward if they had abdominal surgery. So I would review that because that is a major post-op complication, especially of our abdominal surgeries. Additionally, there's what's called the Aldrate scoring system. This helps a PACU nurse determine, is my patient safe to be discharged or go back to their basic med-surg floor, ICU, etc. So it really looks at their activity, their respiration effort, circulation, consciousness, and oxygen saturation. We talked about the different types of anesthesia that these patients are on. It's a really big risk for airway compromise, circulation issues, hypothermia. All of it can kind of lead to a prolonged stay in the PACU because it's really important that we get our patients safe and stabilized before transferring them wherever they may need to go. Especially if they're supposed to be going home. We have a lot of in and out surgeries where they come in and then they get to walk home. Not walk home, but they get to go. So it's really important that we make sure our patient is safe before we send them to their designation. Some other complications can include our VTEs or other clots. Therefore, we really want to make sure we're giving them anticoagulant medications and we're reviewing those panels as well. SCDs help really well, especially if our patient's out of it. We also are at really big risk for infection, delayed wound healing, pain. We're going to treat that with analgesics. And a big side effect of our anesthesia is decreased peristalsis. So we really want to make sure we're doing some bowel sound assessments just so we can make sure that their bowels are still functioning. So again, in order for them to leave the PACU, you're going to need that Aldrate score of 8 or higher. Additionally, their vital signs must be stable with no evidence of bleeding. All their reflexes need to be back to normal, including their gag reflex. And they need to be properly urinating as well, just to make sure all the body systems are working. Additionally, you want to make sure they have minimal or absent nausea and vomiting, minimal, moderate wound drainage, and the anesthesiologist also needs to approve. In order for them to go home, on the other hand, they will end up staying in the PACU a little bit longer. They need to have stable vital signs for an hour. They need to have their baseline level of consciousness, meaning when the patient was assessed prior to surgery, it must match their LOC after, alert and oriented, etc. Their wound drainage must be stable, and they must be able to take fluids orally, meaning they must be able to take a drink of something. Usually in the PACU, they'll have popsicles or juices to kind of help. They must be able to void on their own, dress, and ambulate with assistance. Additionally, they need an acceptable pain level. Also, they must have someone available to take them home. They cannot drive themselves home. No matter how much they say that they're okay, they cannot take you home. So that's just kind of a good overview of our post-op, pre-op, and intraoperative care. Now, does anyone have any questions? Want me to go back to anything before we go ahead and start some practice questions? I believe the PowerPoint also is in the chat for those that need it. But does anyone have any questions? So I'm going to go ahead and get our Kahoot started.
I think you're in mute if you're saying something.
Tiffany, I don't think we can hear you. No.
Okay, can you hear me now by any chance?
Yeah,
Now
we can
you're-
hear you. Yeah.
Okay, awesome. I just don't want to like have you guys have to listen to the annoying loop, but I guess that's just what we're gonna have to do, the music. But yes, so with Parkinson's disease, the tremors at rest, you guys scored really well on, especially the facial expressions and the gait. But I do want you guys to know that with our Parkinson's disease, it's actually associated with our Alzheimer's disease. So that's where we do see some of these cognitive decline with these patients. So really good job. Just want to let you guys know that with Parkinson's, though, we do have some cognitive issues as well. Our musculoskeletal issue that doesn't include those cognitive issues, that's going to be our ALS. Again, another select all that apply. Which of the following statements shows an understanding about the mode of transition of HIV? Awesome job. Good job, everyone. So HIV is only transmitted via blood. So that's why using a barrier method is very important. Additionally, needles, that's again kind of more that bloodborne pathogen. And then for women experiencing cesarean birth, women, we really do want to advocate for a C-section as well. It is not an airborne disease, it's not a droplet disease, etc. And there's really no need to double glove as well. One glove is enough. You're reviewing labs for your chronic kidney disease patient and notice the potassium decreased from 5 to 4.2. Which of the following meds caused this? Oops, I am very sorry about that. It should have been furosemide Lasix. I guess I accidentally clicked spironolactone. But yes, our furosemide is a diuretic that is non-potassium sparing, so it helps us pitch that potassium. So it's a really good drug of choice for patients with CKD because not only does it help get water off, but it also helps them lose all the other electrolytes they're building up, such as sodium, phosphorus, etc. So I apologize for that one. A patient newly diagnosed with Parkinson's asks, what does dopamine do in the brain? What is the best response? Awesome. So dopamine really does help us coordinate motor movement. Dopamine does not stimulate the neurons to transmit sensory and motor impulses. That's more of our acetylcholine. So our dopamine actually helps us maintain these movements. It's not a stimulatory neurotransmitter. A nurse is caring for 4 patients. Which patient is the priority to see? This is a priority patient. So it is our ALS patient who has a respiratory rate of 26 and is experiencing muscle weakness. So what do we know about ALS? Eventually, this ends up affecting the respiratory system where it leads to that respiratory paralysis. So if any patient is experiencing an increase in respiratory rate, to me, that's telling me that my patient is having difficulties breathing. So again, if we use that airway breathing circulation approach, we can kind of prioritize if I see that increased respiratory rate coupled with that muscle weakness, I'm at risk for respiratory failure because eventually my muscles, especially with ALS, my muscles are going to get so tired and weak from trying to breathe, it's eventually going to result in respiratory paralysis. My severe depressive episode, it doesn't take precedence at this moment. A patient just coughing up yellow sputum, that's pretty normal with pneumonia, and a patient requesting medications, not of priority concern. So when you're kind of looking for prioritization questions, NCLEX might trick you a little bit because all these questions come from ATI. NCLEX likes to kind of trick you. If it's a normal finding for that disease process, it's usually not going to be your priority concern.
Yeah, I think if you hit the settings button in the bottom right corner, you should be able to mute the sound.
Oh, really?
I think so.
Let me see.
It says lobby music. Can you?
Rats.
You
That's
okay.
good for next time, though. Guess we'll just have to bear with it. I do apologize. My next question. A nurse is educating a patient newly diagnosed with Huntington's. Which of the following statements should be included? Yes, awesome job, guys. So Huntington's disease, this is our autosomal dominant disease. Meaning with autosomal dominant disease, if you have it, you have a 50% chance of spreading it to your offspring. So again, with Huntington's disease, this results in a major ethical concern, which is why we advocate for family testing, because 50-50 odds might not be something parents want to mess with. Because this disease also has a pretty poor prognosis.
I had a quick question on that one. Oh, if it's
yeah, of course. I'll answer it as soon as this question's over.
Okay.
So we're providing patient teaching for a patient with ALS. Which of the following statements indicate teaching was effective? Awesome job, guys. So with our ALS patients, with the difficulty swallowing, we still want to make sure these patients are hydrated. So doing fluid restrictions isn't going to be beneficial for them. We might need to thicken their liquids, but we do not want to restrict it. Additionally, 1,000 milliliters of water a day is not adequate. Additionally, we do our chin tuck swallowing, so we don't tilt the head back, we actually tuck the chin in. Also with ALS, usually these patients pass away within 3 to 5 years, so that's why it's important we do our end of life discussions pretty quickly. So there was a question on the Huntington's disease question. You want to go ahead and ask?
Yeah, so for that one, I have it in my notes that it's hereditary, autosomal dominant, 100% chance of passing the gene with a 50-50 chance of the faulty gene expansion. So does that mean there's 100% chance, but you know, there's just that 50-50 of the child will get it? I wasn't sure.
No matter what, they'll have they'll have some sort of Huntington's gene. But in order to like express it and have those symptoms, that's going to be kind of like 50-50. So no matter what, they're going to have some sort of like Huntington's gene. But like if you have, let's say, it goes back to kind of Mendel's P's, if you have like big D, little d, but let's say you have another, like your partner is little d, you still have kind of different ratios. But no matter what, you're going to pass on the gene, but it's along the lines of, will my patient's child now express these symptoms that will eventually cause them to pass away?
Okay, thank you.
You're welcome. Which statement made by our ALS patient requires further teaching? Awesome job, guys. Definitely. I know this question seems a little bit easy, but I really wanted to include it because all the other answers kind of help us understand ALS a little bit more. So yes, they will have this limb weakness and twitching and dysphagia. Yes, we want them doing sitting up and doing chin tuck swallowing. And yes, we want to help decrease their constipation. So good job. That's why I really do like questions like these, even if they are a little bit easy, but good job. A nurse is assessing a patient diagnosed with multiple sclerosis. What finding warrants immediate intervention? And it's meant to say slurred speech. I don't know why I put scanning. Awesome. Very good job, guys. So if they have congested cough and dysphagia, that's at risk for aspiration, which can put the patient at risk for pneumonia. Again, it's that airway, breathing, circulation. I know usually slurred speech a lot of people think is a priority because we think, oh, stroke. But actually, patients with multiple sclerosis, it's actually normal for them. So that's why, again, ATI likes to be a little bit tricky. But if it's a normal finding for a disease process, it's usually not a priority concern. And again, if you guys have any questions, you can go ahead and unmute yourself, pop it in the chat, whatever is easiest. Select all that apply. A nurse is admitting a client diagnosed with multiple sclerosis. What clinical manifestation should the nurse assess? So if my patient has multiple sclerosis, Awesome job, guys. So these are all findings of patient with multiple sclerosis. Therefore, I need to ask my patients about these signs and symptoms. Because what do we know about multiple sclerosis? It's characterized by exacerbations and remissions. So all of these symptoms kind of occur during our exacerbations. So I want to ask them about their symptoms. Have you been having them, etc.? Just so you know, it's kind of more like med terminology, but dysmetria, that's just inability to perform smooth, controlled movements. So that's what that one means. And usually those patients won't really present with lethargy. There'll be more muscle weakness, but that's not the same as lethargy. What drug therapy is included for acute migraine and cluster headaches that alters the pathophysiologic process? Awesome job, guys. So what do we give for migraines? We give them sumatriptan. A mnemonic I always like to use for migraines was give me something for my migraine. So that's where like that suma T in sumatriptan. That's just a mnemonic I like to use. I'm a big mnemonic person, but that's typically our drug of choice for migraines. And we can give that IM. Another, select all that apply. A patient's diagnosed with cluster headaches. The nurse knows that which characteristics are associated with these. Awesome job, guys. So they can last anywhere from 5 to 180 minutes. Keep in mind with migraines, it's going to be that unilateral pressure and tightness. It's not going to be bilateral. That's more sinus. Additionally, associated with alcohol consumption, etc. Very good job, guys. A patient has been recently diagnosed with SLE, which of the following statements demonstrates a need for further teaching. And SLE is systemic lupus erythematosus. Awesome job, guys. Unfortunately, there is no cure for SLE, so we're going to do everything we can to prevent our exacerbations, especially staying out of the sun. Select all that apply. The nurse is preparing a presentation on SLE. Which statement should my nurse include? So this is an education question. Select all that apply. Awesome job, guys. Very good. Manifestations are mild to fatal. Why would they be fatal? Well, remember, we can have these immune complex deposits in the heart and the lungs. That can be fatal. Very good. Very good. And our etiology, it's unknown. We really don't know the cause. We know it can exacerbate, but we don't know what's causing the SLE. Select all that apply. A nurse is teaching a patient about COPD. What info should the nurse include? Awesome job. Very good, guys. Remember, with COPD, these patients normally have their oxygen saturation between 88 and 92. That's their normal. Anything more might have them feeling a little bit wonky, might have them feel a little bit out there on another planet, etc. But very good job. So I would definitely review your normal oxygenation for these patients. You're caring for a COPD patient with shortness of breath, respiratory rate of 28, and O2 sats of 82. What intervention would be contraindicated for these patients? Very good job, guys. So if my patient is experiencing shortness of breath, I do not want to lie them flat on their backs. I want to bring them up so that they can breathe a little bit easier. Additionally, I would want to give them oxygen because stats of 82, not very good. Way to go, Kira. A patient with obstructive sleep apnea asks you how modafinil will help. How should you respond? Awesome. All modafinil does is promote daytime wakefulness. It helps with narcolepsy. What's the rationale for using Cpap to treat sleep apnea? Awesome. So what's occurring during sleep apnea? The anatomy of my throat causes my patient to not breathe during night, whether they be choking on their tongue, surrounding structures, etc. So during the middle of the night, my airway closes. So what does CPAP do? That's our continuous pressure airway. So that's going to help positive pressure push open my airway so my airway stays open the whole night. So it's not necessarily an oxygenation issue. Are my red and my blue different? They shouldn't be. I do apologize for that, but yep, they're both the same answer. My bad. Yep, both blue and red were correct. I'm sorry. A patient is taking Nicorette gum to aid in smoking cessation. What statement requires follow-up by the nurse? Awesome job, guys. So we do not want our patients smoking on any type of nicotine replacement therapy because this could actually be very toxic for them. Good job. Definitely review your NRT. A patient with asthma presents to the ER with acute respiratory distress. Which of the following is a priority to report to the provider? Awesome. So, a decreased breath sound and wheezing is our #1 priority. Again, we use that airway, breathing, circulation. So, we also know that this is asthma. What's the issue with asthma? My airway is beginning to close. So, these decreased breath sounds and wheezing, that's my priority. It can be a little bit tricky with the pulse ox. While the pulse ox is low, I know that the reason my pulse ox is probably low is because my airway is being constricted. Therefore, I need to work on my airway. And again, you literally follow it, A, B, C. Airway, breathing, circulation. Circulation, you prioritize circulation after you've already prioritized airway, then breathing. That's a big NCLEX tip, especially when we talk about shock. Select all that apply. What primary preventative measure can a patient who's recently been treated for a UTI follow? So what helps them prevent UTIs? Good job, guys. Awesome job. Perfect. Guys nailed it. This one, select all that apply. The signs and symptoms of anemia are very good job. Very good. Yep, these patients are going to have pallor, tachycardia, and hypotension. How do we classify iron deficiency anemia? Awesome job, guys. So with iron deficiency anemia, we'll have a decreased hemoglobin production. Remember, this is microcytic and hypochromic. How can the spread of tuberculosis be prevented? Very good job. Making sure your patients are in a negative pressure, ventilated room, wearing a mask, etc. Very good. Tuberculosis standards include all of the following except very good job. You do not want to remove your mask before leaving the patient's room. Again, we need fit testing, negative pressure rooms, and PPD test. That's the test we have to do on Castle Branch every year. What are the complications of diabetes? I'm trying to use the code today. Very good job. As you can see, there are lots of complications to diabetes, which is why it's so important we manage them. Good job, Rosie. Answer streak of 11. Very nice. This one, select all that apply. You're caring for a patient with type 1 diabetes with a blood glucose of 242. Which of the following manifestations are expected? So what does this question ask? It's asking what findings are indicative of hyperglycemia? Because 242, that's pretty high. That's borderline DKA. Awesome job, guys. So with blood glucose of 242, this is our hot, dry, sugar high. So this is our abdominal cramps. You're going to have that increased urination. They're going to not have that anxiety. That's usually indicative of hypoglycemia. They're going to just feel very anxious and irritable. Those are big hypoglycemia symptoms. Also, hypoglycemia that's cool and clammy needs candy, so that's where that diaphoresis comes in. The rapid deep respirations, those only come into play with diabetic ketoacidosis. So if this was a DKA patient, absolutely. The only reason that in DKA we have deep respirations is because there's acidosis. So how am I going to compensate for that acidosis? I'm going to be trying to blow off CO2. And usually DKA is indicated at, I believe it's either 250 or 260, but also that's a bit more complex health too. All right, another select all that apply. An EKG reads normal sinus rhythm. Which of the following findings are consistent with normal sinus rhythm? Also added a little Awesome job, guys. So with normal sinus rhythm, you want a heart rate between 60 and 100, QRS complex 0.4 to 0.12. Very good job, guys. Also, we have our PQRS T. So the T wave comes after the QRS complex. And we need to make sure that for every QRS complex, we have a T wave. If not, it is not normal sinus rhythm. What is cardioversion? Good job, guys. This is what's used to treat heart arrhythmias. So abnormal heart rhythms, such as SVT, etc. You see this on your patient's monitor. What do I do first? Awesome job, guys. So you always check for pulse and breathing first. We always assess first. I know you guys had your complex health sim lab in which you had a patient that needed CPR done, but what you did first was you always hey, are you awake? Tap, shout, tap, give them a sternal rub, check for pulse and breathing, because maybe their leads were just off. We don't know, but we always assess first. Which of the following statements about hypertension is true? Awesome job, guys. When a patient is on beta blockers, you must taper those meds. If you don't taper them, they could have massive rebound hypertension. Good job. And remember, with our hypertension, it's usually, there are no symptoms. That's why it's called, quote unquote, the silent killer, because these patients are often asymptomatic. And whoever hit answer streak 4, congrats to all 12 of you. Very nice. What does treatment for essential hypertension focus on? So remember, we're talking about essential hypertension. Yes. So essential hypertension, this is our hypertension with an unknown cause. This is the one that's linked to lots of different risk factors. So we're going to modify those risk factors. And that is number 1. And then we do other methods when that fails. Nursing interventions for fluid volume excess include good job. All the above. We do our daily weighs, measurements, INO. But your most important is going to be your daily weighs. INO can be a little bit off. Always do your daily weighs. That is the best. Patients with chronic pulmonary hypertension develop what? What can they develop with chronic pulmonary hypertension? Awesome. Right-sided heart failure. Why does it cause right-sided heart failure? Well, remember, blood comes from the body to the right side of the heart to the lungs. If I have increased blood pressure in my pulmonary valve, it's going to push it back into the right side of my heart. That's going to cause right ventricular hypertrophy, which leads to right-sided heart failure. Which client has chronic stable angina? Awesome. Remember our chronic stable angina. This is pain that is relieved with rest or nitro. The primary contributing factor to coronary artery disease is very good job. Atherosclerosis. That is plaque buildup, usually from saturated fats. Good non-pharmacological interventions for coronary artery disease include all but Very good. You really need to make sure you're taking your medications as prescribed. All of the following are symptoms of peripheral artery disease except good job. Remember our PAD, that's when we have more ulcers, not that brown discoloration. That brown discoloration is indicative of peripheral vascular disease. Good job, guys. Which symptom is most common in peripheral artery disease? Awesome. That intermittent claudication, that is really, really important in peripheral artery disease. How do we teach our patients to manage? We teach them to walk until they have pain, take a rest moment, and then continue to keep going. Forge ahead. Good job, Cheetah. Select all that apply. The patient is unaware of their new diagnosis of dilated cardiomyopathy. What info can the nurse provide? Good job, guys. So with our dilated cardiomyopathy, this is when we hear those abnormal heart sounds, and it's usually associated with that systolic dysfunction. What do we know about systolic heart failure? That is our HREF, heart failure with a reduced ejection fraction. This is because during systole, we squeeze out to the body. If I have systolic heart failure, I'm not squeezing much out to the body. So that's what results in that reduced ejection fraction. Very, very important. Good job, Kim. You guys are killing it. What bacteria may contribute to heart valve disorders as well as some kidney disorders? What bacteria loves the heart? Yep, it is our streptococcus. They absolutely love to just attach to those little leaflets on the heart. Treatment for a mitral valve prolapse includes very good job, guys. We want to avoid stimulants. All of our ACEs, they do help. Ideally, we want these patients on aspirin, and vasodilators also help. Dilated cardiomyopathy. Finish the sentence. Good job, guys. So with cardiomyopathy, these patients are going to have a lot of orthopnea, especially when they are lying down. What is the patient's mean arterial pressure if their blood pressure reading is 146/87? I know that's okay. Do you guys know how to calculate mean arterial pressure?
Could you go over it, please?
Yeah, no, of course. So when we're talking about our MAP, that's going to be what's helping us perfuse our organs. So if you're going to calculate your MAP, there's two different equations you can use. The first one, it's going to be your systolic blood pressure, and you're going to add it. So it's systolic plus 2D. So 2 times your diastolic, and you divide it over 3. That's one I like to use because there's less room for math errors. Additionally, you could also do your diastolic plus the difference between your systolic and diastolic divided by 3. So you could do diastolic plus, in parentheses, systolic minus diastolic. But I really like your systolic, so you can do like S plus 2D over 3. That's one I like to do. But yeah, it helps us perfuse our organs. Does anyone know what our MAP goal should be? What do I want my MAP?
Is it 60 something?
Yep, we want it greater than 60. Ideally, we want it between 70 to 100. Less than 60 indicates heart failure. Okay? Very good. Which of the following medications prevents the inflammatory response associated with asthma and will require an oral rinse? Good job. Remember, beclomethasone is a steroid. We always want to rinse after using an oral inhaled steroid to avoid thrush. Good job, Ashley. You're caring for a patient undergoing peritoneal dialysis and notice the patient's effluent is cloudy. What action is priority? Awesome, guys. If my effluent is cloudy, I have peritonitis. I have an infection. Therefore, I need to get a culture and sensitivity to determine what antibiotic I need to put my patient on. They are at really big risk for sepsis. I received this on the EKG monitor for a patient with an implanted permanent pacemaker. The pacemaker is so what's going on with the pacemaker? Awesome job, guys. So it is failure to capture. I don't know if it'll let me go back to the image, but I would just review your failure to pace, failure to sense, and your failure to capture. If you go back, I might be able to go back. Maybe? Nope. Okay. but there was a spike followed by no PQRS complex. So what do pacemakers do? We put them at a set rate. If my patient's heart rate gets low, it'll trigger a spike, which is going to pace my heart. What happened in that photo was there was a spike followed by no PQRS. So they tried to spike again, and then we had a PQRS. Okay, so just really review that. I know that's pretty tested upon, pretty heavily tested upon. Select all that apply. Which of the following statements made by the nursing student shows an accurate understanding of peptic ulcer disease? Good job. So our drug of choice for peptic ulcers is sucralfate to help coat. However, you will need multiple antibiotics to treat this. Usually we do have positive H. pylori breath test. You can also see it in the stool, and omeprazole is a great drug. Good job, guys. You did really well on that one. What valve disorder has a high-pitched holosystolic murmur radiating to the axilla and intercostal space left of the midline? I almost guarantee that when Yep, so our mitral regurgitation, that's when we have that high-pitched holosystolic murmur, fifth intercostal space, left of the midclavicular line. So go back to that PCW and just review what you are auscultating for at each point with your mitral stenosis, mitral regurg, aortic stenosis. So just review auscultation because your professor loves that. You're caring for a patient after a hip replacement. To initiate VTE prophylaxis, which of the following actions should be Good job, guys. So we love to give our enoxaparin. That is a Lovenox injection. It is a low molecular weight heparin. And we want that because it's a much, much safer drug. We really don't need to be monitoring their PT, INR, anything like that. And I bet quite a few of you have given it in the hospital. Another, select all that apply. You're caring for a patient with HIV who shows the following labs. Which of the following conditions could the patient develop? So you see these labs. What am I thinking? What's the thought process? Good job, guys. So those are very, very low neutrophil counts. So my patient is at increased risk for infection. So which of these are opportunistic infections? Tuberculosis, Kaposi sarcoma, oral candidiasis. Very good. You're providing education to a patient scheduled for left knee arthroplasty. Which of the following should be included in the teaching? Good job, guys. Before surgery, we keep these patients MPO. Polycystic kidney disease is initially treated by Good job, guys. So ideally, we don't want to go in and start taking out the cysts because they could, redevelop. That's more of our third line treatment. We also do not want them on NSAIDs or mycins. Why? NSAIDs and mycin antibiotics are very, very harsh on the kidneys. We need to preserve kidney function. So some antibiotics that are not your mycins, usually they'll be called renal dose. So you'll renal dose antibiotics, and diuretics are very, very good. But I would, especially for pharm, know that your mycin drugs are your most nephrotoxic. That's like your vancomycin. She's a lot. Select all that apply. What are ways that polycystic kidney disease is managed? Good job, guys. So with PKD, we really do need to manage our blood pressure. We want to manage pain, and because this is genetically inherited, we want to seek genetic counseling. Very good job, everyone. What medication should we avoid? Good job, guys. We want to avoid anticholinergics. Why? Remember, our anticholinergics dry us up. They give us urinary retention. With these patients, we want to avoid urinary retention because they're already having a hard time with excretion. An elderly patient with BPH is admitted. Which of the following is the most appropriate nursing care plan? I also included the photo just to reinforce. How do we test for BPH? We test with the PSA test. All right, guys. So ideally, what's part of our patient care plan is we want to leave the bathroom light on at night because they're going to frequently need to use the bathroom at night. So when we're thinking of care plans for our patient, I want you guys also to remember safety. So while green is technically like it's a good idea, we want to monitor their output. We want to prioritize safety first, and that's going to be why we leave the bathroom light on so that there's no fall risk, because they have what's pretty significant about BPH is nocturia. Good job, Rosie. Another select all that apply. Osteoporosis medication and prevention includes, oops, And I'm pretty sure I accidentally hit 220 seconds instead of 20, but we'll be okay. Okay, so our osteoporosis medication prevention includes everything. So lifestyle changes, we know smoking's a risk factor. Aldrate, very good med for osteoporosis. Making sure we get nice vitamin D and calcium. Very good job. Good job, everyone. These nursing interventions can be delegated to the nursing assistant, or like your patient care tech, your nurse tech, assistant personnel. Sorry guys, that was kind of quick. These interventions can be delegated to a nursing assistant, INO, and ambulation. Ideally, we don't really want them transferring them for the first time after surgery. That's more occupational therapy. We call the providers, and we are the ones that give meds. Great job, everyone. There you go, Jen. Back in the game. Select all that apply. Which of the following are true of osteoporosis? Select all that apply. Good job, guys. Again, all the above. Very good job. Remember what's interesting about our parathyroid hormone? Our parathyroid hormone puts calcium back into the blood. If I have hyperparathyroidism, my parathyroid hormone is extra active. Where's my parathyroid hormone getting calcium from? It pulls calcium from the bones and puts it in the blood. That is our parathyroid hormone. A nursing assistant is allowed to do which of the following when providing foot care for diabetic patients? Good job. They can take a look at their feet for signs or source of infections. Because usually they're the ones giving bed baths, etc. Remember, with clipping toenails, we really want to refer them to a trained specialist, such as a podiatrist. Select all that apply. You're assessing for a DVT. Which of the following are clinical manifestations of a DVT? You guys are cracking me up in the chat. All right. Yes, so with DVT prophylaxis, prevention, what are we assessing for? You'll see that erythema wherever the DVT is. It'll also be warm to the touch. You're able to actually feel like an induration and really, really bad pain. When teaching a client about management of her migraine headaches, which of the following statements indicates our teaching was effective? Good job, guys. So with our patients with migraines, not a lot much we can do. We're going to keep them cool. We're going to keep them calm. We're not going to be knocking on their door every 5 minutes. We're just going to let them relax. A patient with IBS is having an exacerbation and states finding her occupation increasingly stressful. Yes, we are going to be therapeutic. We are going to be empathetic, and we are going to ask them, what have they done in the past to cope with stress? Why? Because IBS is triggered by stress. Good job, everyone. You guys are doing so good. So good. Select all that apply. A patient undergoing chemo shows a platelet count of 130,000. Which of the following should we be? Is that a normal platelet count? What do we want my platelet count to be? Do you guys know? I would recommend top of your head. Good job, guys. So we don't want them taking any aspirin because they already have such a low platelet count. They're going to be bleeding a lot. Remember, our normal platelet count, that's between 150K to 400K. That's a good number for us. Therefore, we need to teach safety, electric razors, etc. We never advise really using an enema because there could be some trauma with doing it themselves that could cause bleeding. So, yeah. Which of the following are nursing interventions for patients with GERD? Good job, guys. So what do? We're going to provide education, we're going to ensure proper nutrition, and we're going to relieve their pain. We also want to increase fluids for these patients. After eating, a patient with GERD should... Also, this might not be the best food for a GERD patient. I was just really hungry when I made this. Good job. You want them to sit upright. Very good. All of the following are effects of malnutrition except... Good job, guys. So remember, again, this kind of goes along the lines of knowing your normal lab values. I know there's kind of been some like questions about when on the NCLEX will they provide lab values. At least in my experience, if you ever have a case study that provides lab values, but usually your traditional regular questions may not have lab values associated with them. So I would just remember kind of knowing your normal lab values for a good amount of your meds, especially when you're in the clinical setting, just because these are routine CBC stuff. So our creatinine 0.2, that's normal. Prealbumin, normal. That serum albumin is a normal finding, so that 4.2 is normal. So if my patient's malnourished, they're not going to have a normal serum albumin level. So just kind of review some stuff just like that that I would review. Bariatric surgery increases the risk of malnutrition. Good job, guys. So what does bariatric surgery do? It removes portions of your digestive tract, your stomach, so that's less area for absorption. Also, these patients can only take in a less, like they can take in less food. Therefore, if my patient's stomach can't hold a lot of food and they decide to waste their space on chips that have no nutrients, really big risk for malnutrition. So that's why we're going to monitor these patients' serum albumin levels. Another true or false. IBS can cause both diarrhea or constipation. Good job, guys. It's true. And remember, it should be ingrained in your head. It is exacerbations and remissions, crampy abdominal pain, diarrhea, or constipation. Very good job.
Oil on her food. Practice.
You know what that is?
Yeah.
You do that.
Which nursing action will be included in the plan of care for a 25-year-old male patient with a new diagnosis of IBS? Good job, guys. So we want to express them to ask questions. Also, NSAIDs are helpful for these patients. Milk and dairy help, etc. Yes, the dramatic music. I've never done a Kahoot this long, so I think we ran out of the other soundtracks, but I think it's very fitting because it's almost the end, and I get it. Very cool. Now it's gone. Oh well. This bacteria is often linked to peptic ulcer disease. Good job, guys. It's good old H. pylori. Look at Julia go. She is back in the game. Which of the following is an intervention of peptic ulcer disease? Good job, guys. Remember, in order to treat peptic ulcer disease, you want to be on that combo therapy. It's talked a little bit more about in pharmacology, but usually it's antibiotic plus a proton pump inhibitor. So just review that, maybe for fun, especially. Good job, Kira. Answer streak. Which of the following is not a complication of peptic ulcer disease? job, guys. So peptic ulcer disease usually doesn't cause diarrhea. Remember that ulceration can lead to perforation, which can lead to hemorrhage, and abdominal pain is very common. What should be the major goal of nursing management for a patient with heart failure? Good job, guys. Our goal for nursing management is to reduce that cardiac workload. With heart failure, we have an issue with cardiac output. So that's why increasing the venous return isn't really associated with this. Good job, Rosie. Nursing intervention for permanent pacemaker failure. So my patient is having an issue with their pacemaker. My pacemaker is just not working. Remember, this is our failure to capture. Do you think that's like a really, really big deal? Yep, we're going to need to call my MD, and what we can actually do is we can pace them by like placing a transcutaneous pad over them, because honestly, that pacemaker is the only thing that's keeping their heart pumping. So yeah. Ray, you're back in the game. Which sign and symptom is not right-sided heart failure? Good job, guys. So crackles would be indicative of left-sided heart failure. Remember, if you have left-sided heart failure, think lungs. You're having symptoms associated with the lungs. Right-sided, that rocks the body with fluid. So that's when we're going to have that edema, JVD, weight gain, splenomegaly. All the above. Congratulations on your answer sheet, Cam. There we go. Which sign and symptom is not left-sided heart failure? Good job, guys. Incontinence. Which lab result confirms suspicions of heart failure? Good job, guys. An elevated BNP indicates heart failure, because with BNP, think stretching. There's so much stretching happening in my heart. Well, what's causing heart stretching? You've got hypertension, which can lead to heart failure, etc. Very good. Potassium isn't really associated with heart failure. Maybe you're thinking more kidney failure. But yes, that is an abnormal potassium level, but is it related to heart failure? Not necessarily. So this one's about asthma and prioritizing. A nurse in an urgent care center is caring for a client who's experiencing an acute asthma exacerbation. Which of the following actions is the nurse's highest priority? So let's prioritize care. What do we do? So what do I do first? Good job, guys. So I'm going to talk about this a little bit. So again, NCLEX is very big on airway, breathing, circulation. First, you establish the airway. Then you work on breathing. Then you deal with circulation. What is circulation? O2 sats. Okay? So with asthma, if I'm having an acute asthma episode, my airway has closed off or is almost closed off. So while yes, I do want to sit them up and I do want to initiate oxygen therapy, none of that will work unless I establish an airway. How do I establish an airway for a patient who's having an asthma exacerbation? I open up their airway by using a beta adrenergic. That is our SABA, short-acting beta adrenergic. That is our albuterol. So in order to give oxygen therapy and in order to help them breathe on their own, I need to open the airway. The only way to open the airway of a patient who's asthmatic is to give them their albuterol. Does that make sense? Does that help clarify the airway breathing circulation? I hope that helped. Okay, awesome. Which is not a trigger for asthma. Good job, guys. A beautiful summer day is not a trigger for asthma. All the rest are big triggers for asthma. Good job, Cheetah. All right, guys, we have about 2 more questions. What condition thickens vessels due to the calcification and buildup of connective tissue? Yep, that's going to be our arteriosclerosis. This is connective tissue. Our atherosclerosis, that is the buildup of plaques, usually saturated fats. Briefly describe osteoarthritis. And I included some fun photos. Good job, guys. So this is a loss of cartilage with bone inflammation. It is not an autoimmune disorder. It doesn't involve uric acid. That is gout. And again, it's not autoimmune. What is autoimmune? That is our rheumatoid arthritis. All right, guys. One more question. Which of the following nursing interventions can help patients with osteoarthritis avoid falls? Select all that apply. This is safety. Good job, guys. So for safety, we want to preserve range of motion so that they still can function really well. Calcium